Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. Today, we are continuing with our series on health, wellness, and beauty tips for Christmas, and we are going to be talking about indigestion. If you're new to this channel, this is a channel where we educate ourselves on common health problems. So I'll be very happy if you hit on that subscribe button and also on the notification bell so you will be notified anytime I release a new video. Our main focus today is going to be on home remedies and lifestyle changes that you can make to get rid of indigestion. But before we get to that, I want to give a brief overview of what indigestion is, some symptoms that you would experience when you get indigestion, and also some of the causes of indigestion. Indigestion is also called dyspepsia or an upset stomach. It is a discomfort in your upper abdomen. It is not a specific illness, but it is a term that describes certain symptoms such as abdominal pain and a feeling of fullness soon after you start eating. Indigestion can also be a symptom of various digestive diseases. It is quite common, and it is one of the most popular cases that customers present with in the community pharmacy. Although indigestion is common, each person may experience indigestion in a slightly different way. Symptoms of indigestion may be felt occasionally or as often as daily. Indigestion may often be relieved with lifestyle changes or home remedies and medications. Symptoms of indigestion usually come on soon after eating or drinking, and sometimes there can be a delay between eating a meal and experiencing indigestion. Symptoms of indigestion include early fullness during a meal. That is, you haven't eaten much of your meal, but you already feel full and may not be able to finish eating. There can also be uncomfortable fullness after a meal. That is the feeling of fullness which lasts longer than it should. There can be a discomfort in the upper abdomen. You would feel a mild to severe pain in the area between the bottom of your breastbone and your belly button. There can be burning in the upper abdomen as well, which would present as an uncomfortable heat or burning sensation between the bottom of your breastbone and your belly button. Bloating in the upper abdomen is another symptom of indigestion. You feel an uncomfortable sensation of tightness in your upper abdomen. Nausea is another symptom where you feel as if you want to vomit. There can also be vomiting and belching. Sometimes people with indigestion also experience heartburn. Heartburn is a pain or burning feeling in the center of your chest that may radiate into your neck or back during or after eating. Mild indigestion is usually nothing to worry about. But if the discomfort persists for more than 2 weeks, then consult your doctor because it may be a signal of a more serious condition in some cases. It is important to seek medical attention if you experience symptoms such as frequent vomiting, when there is pain when you're swallowing, when your stool becomes bloody or black, when there is weight loss or loss of appetite. Also, when you experience a new or worsened heartburn, when indigestion is accompanied by shortness of breath, sweating, or pain that radiates to your jaw, your neck, or arm. So what causes indigestion? Indigestion is thought to occur when your stomach acid comes into contact with the sensitive protective lining of the digestive system. The symptoms will occur when there is an increased sensitivity of the protective lining to acidity or stretching. The stomach acid breaks down the lining, leading to irritation and inflammation, which can be painful. In most cases, indigestion is related to eating, although it can be triggered by other factors such as smoking, drinking alcohol, pregnancy, stress, or taking certain medications. Other common causes of indigestion include overeating or eating too quickly, fatty, greasy, or spicy foods, too much caffeine, too much alcohol, chocolate, or carbonated beverages, smoking, anxiety, and stress. Also, certain medications such as certain antibiotics, pain relievers, and iron supplements. Sometimes indigestion is caused by other conditions, including inflammation of the stomach, peptic ulcer, celiac disease, gallstones, constipation, inflammation of the pancreas, stomach cancer, intestinal blockage, reduced blood flow in the intestine, diabetes, thyroid disease, or pregnancy. Standard treatments for indigestion include antacids or medications that decrease acid production or help the stomach move food more quickly into the small intestine. And there are various types that you can purchase from your local pharmacy. But today I'm going to focus on some home remedies and lifestyle changes that you can practice to help with indigestion. Mild indigestion can often be helped with some home remedies and lifestyle changes. And the first home remedy I want to talk about is ginger. Ginger is a natural remedy for indigestion because it can reduce stomach acid. The same way too little stomach acid causes indigestion, too much stomach acid has the same effect. Make yourself a cup of ginger tea and drink it as needed to soothe your stomach and get rid of indigestion. The second home remedy is chamomile tea. Chamomile tea is known to induce sleep and calm anxiety. This herb can also ease stomach discomfort and relieve indigestion by reducing stomach acid. Chamomile tea has also got anti-inflammatory properties, so it can stop the pain associated with indigestion. To prepare chamomile tea, place 1 or 2 tea bags in boiling water and leave it in for 10 minutes. Pour it into a cup and add some honey if you like. Drink the tea as needed to stop indigestion. Chamomile contains an ingredient that acts as an anticoagulant, so there is a risk of bleeding when combined with a blood thinner. So make sure you speak to your doctor if you're on any blood thinning medication before you drink chamomile tea. Home remedy number 3, lemon water. Lemon has got an alkaline effect, so it is able to neutralize stomach acid and improve indigestion. Mix a tablespoon of lemon juice in hot or warm water and drink a few minutes before eating. Apart from easing indigestion, lemon water is a great source of vitamin C, which is an immune system booster. And home remedy number 4, peppermint tea. You can make peppermint tea using fresh peppermint leaves, dried loose peppermint leaves, or tea bags in hot water. Once made, you can drink it as often as you like to relieve indigestion. It is refreshing. It has a cooling and minty taste. Peppermint tea is known to help relieve symptoms of gas and bloating and can relax the digestive system. There is also some evidence that peppermint tea may not be suitable for people with gastroesophageal reflux disease, or simply put, acid reflux disease, as it may make the symptoms worse. If you suffer from heartburn, hiatus hernia, or kidney stones, then it may be wise to avoid peppermint tea, as it can make the symptoms worse. And home remedy number 5, make some lifestyle changes. Eat smaller, more frequent meals. Chew your food slowly and thoroughly, and do not chew with your mouth open. Do not talk whilst you're chewing. as this can make you swallow air and make indigestion worse. Avoid late night eating and try to relax after meals. Also avoid triggers such as fatty and spicy foods, processed foods, carbonated beverages, caffeine, alcohol, and smoking, as they can trigger indigestion. Maintain a healthy weight, as excess weight can put pressure on your abdomen, pushing up your stomach and causing acid to come back into your esophagus. Exercise regularly to help you keep off that extra weight and promote better digestion. And manage stress. Create a calm environment at mealtime. Practice relaxation techniques such as deep breathing, meditation, or yoga. Spend time doing things that you enjoy and get plenty of sleep. And finally, change your medication. With your doctor's approval, stop or cut back on pain relievers or other medications that may irritate your stomach lining. If your medications cannot be changed, then make sure you take them with food. I hope you have learned something today. Please give this video a thumbs up, share with family and friends, and if you haven't yet subscribed to this channel, please hit on the subscribe button and also on the notification bell so you don't miss any video that I upload. Leave your comments and your suggestions in the comments section. Thank you so much for your time today, and I hope to see you soon in my next video. Bye for now.